Now we'll move into the next section and we'll be discussing risk factors for youth mental health. So there are several variables that will hinder or promote youth growth. So the presence or absence in various combinations of protective and risk factors could contribute to the mental health of youth. We need to identify the protective and risk factors in youth, which may guide the prevention and intervention strategies to pursue with those kiddos. And then also protective and risk factors may also influence the course the mental health disorders might take if they're present. So this section will be on the risk factors, and then the next section will go over the protective factors. So what are risk factors? A risk factor can be defined as a characteristic at the biological, psychological, family, community, or cultural level that precedes and is associated with a higher likelihood of problem outcomes. So really they could be genetic, biological, environmental, and cultural. So we're going to look at those different areas. So first, let's look at the individual. So some of these might be biological, some of these might be environmental. So more males than females uh, will have a diagnosed mental condition. Students with poor self-esteem or poor social skills might be a risk factor. Identity issues, especially in thinking about our LGBTQ plus kiddos and folks, those students that are struggling with identity issues, especially if they don't have any support, are at higher risk. Students with chronic medical conditions, we always want to remember that. So our kids with chronic asthma, our kids with sickle cell, our students that might be diagnosed with cancer or other conditions, we always want to pay attention to them. Students that have perceived incompetence within themselves, or if they've been told that. Early puberty in the research also shows that could be a risk factor. Chronic stress, which we're going to be talking about when we get to the family community and the school, but just students in general that have chronic stress over and over again are at increased risk. And then any of those that have trauma, either physical abuse, emotional abuse, or sexual abuse, they are definitely at higher risk for mental health conditions. And then if they're involved with the Department of Juvenile Justice at an early age, so if they do get in trouble with the law at some point early on, then that could be an increased risk for identifying possible mental health conditions for students. When we think of family, there's so many with family. First one we want to look at is something with the genetics with family. So students that have parents with diagnosed mental health conditions or substance abuse issues can be at higher risk. But the research shows that usually the kids would have a different diagnosed mental health condition than the parents do. If there's parent and child conflict and a lot of fighting in the home, poor parenting, and lack of supervision, which is another one on here, and lack of that family bonding. Poverty, poverty, poverty. So our students in poverty are at an increased risk of having more mental health issues for a variety of reasons. And then just parental and marital conflict and divorce, as well as them seeing that domestic violence, again, going back to that trauma that we talked about in the previous slide, can increase the risk. Students that move a lot, around if their housing is unstable, which also could include that parental unemployment. So all these things that could kind of take place in the family could put students at increased risk of developing a mental health issue. Then we think about the school, neighborhood, and community. There's so many here that I can't touch on all of them, but some, again, going back to that peer rejection and bullying that might be related to their identity, just not having any good peer relationships, or having them and then having a loss of peer relationships. And that's just with a romantic partners or with friendships and having that loss. Seeing and being involved in school violence, and that could also take place with some bullying. The not having any adult support or an adult relationship in the school building. That's one of the reasons when we get into the next section on protective factors, that really building those relationships up with our kids is such a strong protective factor, because we do see that as a really high risk factor, especially as kids move into high school. And then also community violence, which we know that has had a traumatic impact in our neighborhoods from our students on the amount of community violence and gun violence and police violence that they have seen that can cause that trauma with our students, that could increase their risk of some mental health related issues. But the good news is We do have, like I mentioned, protective factors. And protective factors can be defined as a characteristic at the biological, psychological, family, or community level that's associated with a lower likelihood of problem outcomes, or that reduces that negative impact of the risk factors of the problem on the problem outcomes. And we're going to go into that in the next section on what these protective factors are that we want to increase in all of our students.